Hi, welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs coloring book by myself to help med, nursing, pharmacy students, and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. If you find this helpful and want to support this series, tap like, share, or drop a comment. Every bit helps. And with that, let's begin. All right, today we're covering Baclofen, also known as Leorisal, one of our go-to meds for spasticity. I'm going to color the brand name in a gradient from red transitioning to green, with the red symbolizing the discomfort that can be associated with muscle stiffness and spasms, and the green symbolizing muscle relaxation. As I just described, Baclofen is classified as a muscle relaxant. If you haven't seen in our earlier videos, under the brand name is our PharmaLink phrase. It's something I created as a quick memory hook that connects the brand name, generic name, and summarizes it in a picture. It gives your brain something to latch onto and reduces the need for repetitive memorization. Okay, mechanism of action. Baclofen is a GABA B receptor agonist. And if we flip back to our high-yield CNS review, we'll remember that GABA is the brain's main inhibitory neurotransmitter. It slows down overactive neurons, it calms signaling, and it helps balance excitation. So anytime a drug increases GABA, you get a quieter, more relaxed nervous system. Now, baclofen specifically reduces neural transmission in the form of muscle contraction signals. Decreased transmissions decrease muscle contraction. The indication for baclofen is spasticity. This is typically due to a neurological disorder where the communication between your brain and spinal cord is disrupted and causes the muscles to stay overly tight and reflexive. A helpful way to remember baclofen's purpose is to think back, like your spinal cord, as it helps calm muscle spasms that originate from that area. Baclofen comes in an oral form, but also in an intrathecal form through a surgically implanted pump. So why intrathecal? Delivering baclofen directly into the cerebrospinal fluid allows for much lower doses with stronger effects and fewer systemic side effects. Baclofen carries a black box warning for withdrawal, especially with intrathecal pumps. Stopping abruptly can trigger hallucinations, seizures, high fever, and severe rebound spasticity. This can also happen with oral forms, but less commonly. The primary side effects of baclofen are sedation and confusion, which reflect its action as a CNS depressant. By reducing excitatory signaling, baclofen also lessens alertness and cognitive clarity, particularly when therapy is initiated or when doses are increased. And that completes our review. See you next time.